Welcome to page 52 of Anatomy Coloring Book. This is Dr. Stephen Harkins. Muscles of scapular stabilization. The scapula is known as the wings on the back. In colloquial terms. But it is the site of many muscle attachment, and it allows for the scapula, allows for greater mobility of the upper limb, of the shoulder joint, and greater range of motion of the arm. The first muscle that stabilizes the scapula, and it is the largest of all the scapular stabilizers, is the trapezius, known colloquially as the traps. And it is this muscle from the skull, the occiput, the base of the skull, the superior nuchal line, is the origin, and then it sort of curves down to the scapula. More origin points come from all the way down the vertebra, the cervical vertebra, the vertebrae of the neck, the vertebrae of the thoracic spine, all the way down to T12, you can see here. And sort of wrapping and inserting along the spine of the scapula, that's this area right here, the spine of the scapula. And also wrapping around and inserting on the clavicle, the distal 2/3 of the clavicle. If you can imagine these fibers coming off like this, forming this massive muscle. When you shrug your shoulders, when a bodybuilder shrugs their shoulders, you can see that bump of this trap muscle contracting. Or when you say somebody has no neck, a football player, that's because they have massive trapezius muscles. And of course, here it is from the side, from the superior nuchal line of the occiput, and down, inserting, this is the origin, and then inserting on the clavicle, the inside of the clavicle, and the spine of the scapula, and then the fibers down to the thoracic spine. The job or action of the trapezius muscle is retraction of the scapula. That is bringing the scapula backward. Bringing the scapula backward, pinching the shoulder blades back. Pinching here's the spine right here. Pinching the shoulder blades back in a movement called retraction. Squaring the shoulders. You get into a tight military postures with your shoulders back. That's retraction of the scapula. Another action of the trapezius is a shrugging of the shoulders called elevation of the scapula. Elevation of the scapula. And it's the upper fibers up here of the trapezius that elevate the scapula. The upper fibers. The fibers that retract the scapula are the middle fibers. Now, the lower fibers do something different. They depress the scapula. They bring the scapula down. So, the scapula downward. And so, if you think of the three levels, parts of the trapezius, upper, middle, and lower, you can see that they have three very distinct actions. Now, lastly, the trapezius, the upper fibers will perform another action, which is called rotation, upward rotation. It's when the scapula or the wings rotate up like this, rotate up. And so by its angle, it pulls the scapula up and in and allows the arms to raise above the head and behind the head. And that is the trapezius muscle. The next muscle, a scapular stabilizer muscle, is the rhomboid major and the rhomboid minor. The rhomboid major muscle, and people often, the sore spot for people right between the shoulder blades, and they often have pain here from trying to keep the shoulder blades in a retracted position, or perhaps they've been stretched from a protracted position. The rhomboid major below and the smaller rhomboid minor above. And you can see their attachment there underneath or deep to the trapezius. The trapezius has been cut away here. And they originate, the rhomboid major and minor, from the vertebrae of the thoracic spine, and potentially C7 as well, all the way down to T2, T3, T4, T5, T6 to T7, T1 to T7, thoracic 1 to thoracic 7. And the job of the rhomboid major and rhomboid minor is to, as we said, retract the scapula. And you can see the fibers of the middle fibers of the trapezius performing a similar action to the rhomboid major and the rhomboid minor. The next muscle of scapular stabilization is the levator scapula. And I think you will know by the name the action of the levator scapula. What does it do? We'll find out. Levator scapula is this muscle here, which originates from the transverse processes, or the vertebra of C1, cervical 1, 2, 3, 4, and inserts on what's called the superior angle of the scapula. That's this area right here. This is the superior angle of the scapula. This angle right here. And the insertion you can see right at the superior angle. So you can guess if this is the origin here and the insertion down here, you can guess the action of the levator scapula is to elevate, elevate the levator scapula. So it's in the name, levator scapula, elevate scapula. And from the side view, you can see a little peek of the levator scapula attaching to the first 4 cervical vertebrae, originating and then going deep into the insertion on the superior angle of the scapula. The next muscle of scapular stabilization is the serratus anterior muscle. This is a very unique muscle. On your chest wall here, here's the levator, or excuse me, the serratus anterior. Serrated because if the name, it says in the name, serrations of a knife, the bumps on a knife, the sharp points of a knife. It resembles sort of the sharp points of a nice serrations of a knife. And you can see, in fact, the serratus anterior, it has a serrated shape to it. And it sort of wraps along the ribs here, the 5th, 6th, 7th, 8th, and the intercostal muscles here, and originates there and wraps around. Here's another view of it right here, all the way up to ribs 1, 2, 3, 4, 5, 6, 7, 8. And notice how it has a very clever insertion point. It goes underneath, here it is again, underneath the scapula, and does not attach on this border here of the scapula. But what it does is it goes all the way underneath and attaches here underneath the inner border of the scapula. So it goes underneath the bone itself and then attaches. And what it does is it pulls the scapula out this way. It reaches from all the way in here and pulls the scapula outward into this position, this protracted position right here. So the insertion, the origin is on the ribs in the front here. This is the origin. This is the origin right here on the ribs. And the insertion, I'm gonna show you the insertion down here. Dot, 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 under, dot, 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 under, then it attaches, dot, 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 under, and then it attaches. Dot, 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 under, under. So it attaches on this border over here, the medial border of the scapula, from underneath. And then it pulls the scapula into protraction. And this is the motion when you see a bodybuilder flexing, sort of opening up his wings. This is that's the movement of the action of the levator scapula, protraction. And lastly, the muscle, the pectoralis minor. We've talked about the pectoralis major, which moves the shoulder joint. The pec minor is like the pec major in that it is a chest muscle of the anterior chest right here, originating on the anterior ribs and then inserting on the coracoid process right here, the coracoid process of the scapula. The pec minor also, you can see from its vantage point here, will pull the scapula this way into protraction, pulling it outward into protraction, assisting the serratus anterior. So on the diagram above, you can see, which I failed to point out, the insertion point here of the rhomboid major and minor on the medial border of the scapula here. Rhomboid major, rhomboid minor. And you can also see on the underside, this is the anterior view, underneath the scapula, you can see the insertion point of the serratus anterior on the medial border, but the underside of the medial border, the part that you cannot see right here, dot, 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 dot. That's the insertion of the serratus anterior underneath the medial border, whereas the insertion of the rhomboid major and rhomboid minor is on the medial border itself. So right underneath that, the insertion of the rhomboid major and minor is the insertion of the serratus anterior. You can also see here the action of upward rotation, another action of the serratus anterior, is that it comes around from the anterior chest wall here, the ribs, wraps around your chest back here, inserts on the medial border, and helps to pull it around into upward rotation of the scapula for reaching above your head. When your arms want to reach for something high, these muscles, all of these muscles, will stabilize the scapula so that your arms are able to perform those actions. This represents the end of page 52 of Anatomy Coloring Book. This is Dr. Stephen Harkins. Until next time.